So today I'll be talking about liver cancer, and I thought this topic is important because we are seeing a lot more patients of liver cancer than we used to see in the past. Now, specifically, I'm going to be talking about the relevance of liver transplantation as an effective curative treatment for liver cancer. Now, before we go into the details of discussing liver transplantation for liver cancer, there are two important differences that we have to keep in mind. That how is liver cancer different from most cancers that occur inside the body? The first major difference is that liver cancer generally does not develop in a healthy liver. 8 out of 10 liver cancers develop only when there is some pre-existing damage in the liver. Now, this damage can be either a viral hepatitis, it can be liver cirrhosis, even a simple disease like a fatty liver disease can be a precursor for a liver cancer. The second difference of liver cancer from other cancers in the body is that most of the effective treatment modalities that are available for liver cancer, which can be a liver surgery in which we remove a part of the liver, and then there are other treatment options like localized radiotherapy, localized chemotherapy, etc. But what is important to remember is that most of these effective treatment modalities require your liver to be functioning properly. So if the liver is already damaged and the liver is not working properly, most of these curative treatment options might not be applicable for you because the liver is already damaged. Now, this background information is important because generally people believe that if you have a cancer, then you cannot have a transplant. Liver transplantation can be considered as an option for the treatment of liver cancer because, like I said, that liver cancer is not one disease, but it is two diseases. It is the liver disease and it is the cancer. So when we do a transplant, we are curing the liver disease and we are also taking care of the cancer. So that is what makes liver transplantation an extremely effective treatment modality for the management of liver cancer. Now, the other advantage of doing liver transplantation for liver cancer is the fact that any tumor that happens in the body once has a high likelihood of the tumor coming back inside the body. Now, like I said, that when you have pre-existing liver disease, the treatment options are extremely limited because you need a healthy liver for those curative treatment options. Whereas when we do a transplant, the patient after transplant has a new healthy liver. So even if, God forbid, the tumor does come back after a transplantation inside the new liver, the treatment modalities which are available to the patient are much more than they were when the liver was damaged. This said, I am not trying to say that every patient who has a liver cancer and who has got liver disease is a candidate for liver transplantation. No, that is not true. There are stringent selection criteria in which patients have to fulfill those criteria before they become eligible for liver transplantation. If the liver cancer has spread outside the liver, or if it has started involving the blood vessels which are supplying the liver, then those patients are not candidates for liver transplant. In some cases, even if the cancer is advanced or if the size is very large, even in those situations, occasionally the liver cancer can be brought down to a certain size, which is then this treatment process is known as downstaging, and these patients can be considered for liver transplantation after this process of downstaging. Liver transplantation. If you have any further queries, you can reply to this, and we will be happy to give to give an answer to your queries. Thank you. Take care of your health. Take care of your liver. Bye.